Hi guys, today we'll be discussing on how to take a good history in pediatrics. History taking or clerking is a very important aspect of medicine, but today we'll be focusing on how to take a good history in pediatrics. Now, the component of history in pediatrics include the biodata, then the presenting complaint, history of presenting complaint, and after that you can go to the past medical history, obstetric history, immunization history, developmental milestone or history, then you talk about family and social history. Let's dive into this and make it interesting. Now, first thing, we go into the biodata. The biodata contains the name, the age, the sex, the address, the religion of this child, as the religion of the parents, which is of the child too. Then, yeah, we've already talked about their location, so you should also know about the, the, the tribe, not just the religion. The child's of school going age, you should know about the class, the school. These are things you should know. So let me read a sample biodata for you. You get. My patient is AS, a 4-year-old male. So you must add that. A 4 years old male who is a pupil of Aslem Group of School. He is in primary 2. He resides with his parents at number 10 Ojo Street, Ekoma. They are Asa and Christian. Informant is the mother. As simple as that. The biodata is complete. After that, you move on to what we refer to as the presenting complaint. What brought this child to the hospital? What's the reason this child came to the hospital? For presenting complaint, just simply mention that. And also, you mentioned the duration of the symptoms. The mother said, my child came to the hospital because of fever. He has been having fever. You say, for how many days, ma? Says for 4 days. Okay, what else? Vomiting. For how many days, ma? He says for 2 days or 3 days. Just simply say, who presented via, where the child come through? Chair. That's a children emergency room. They say, who presented via children emergency room on account of, you get, so you mention on account of what are the symptoms? Fever, 4 days duration. Then you also mention vomiting, 3 days duration. As simple as that. That's the presenting complaint. But for exam purposes, you can actually do a quick review of system. Is your child, apart from vomiting, does your child stool? Does your child have a pain while urinating? You just try to ask all of that questions in a different system. You get now, so that the woman may not actually forget one, and when you are actually at the end of your history, she now remember a symptom that you now come and start adding. That may be stressful for you. You get. So that's what you simply do in the history of presenting complaint. Next, history of presenting complaint. In history of presenting complaint, you actually do a lot. Yes. So what do you do there? First thing, those symptoms the woman mentioned, the presenting complaint, you analyze them. Child comes with fever, you analyze the fever. Important symptoms should always be analyzed. Analyze them. In my next video, which is already posted, you will see how I will mention how to analyze common symptoms. You know them, how to analyze common symptoms. For example, this child that came with fever, you analyze the fever. When did the fever start? Then you ask, is the body very hot or just hot? Is it present all through the day or at some part of the day? Is it worse at any particular time of the day? Is it worse at night? What have you done to relieve it? Do you give your child paracetamol? Will it reduce it? What else do you do to reduce it? Did it continue till your child came to hospital? These are important questions. You don't just ask any hard questions. Important questions. So let's put it in order. Let's analyze fever, for example. Say, fever was said to have started 3 days or 4 days prior to presentation. Body was said to be very hot. It was present all through the day, but worsened at night. It was transiently relieved by paracetamol and tepid sponging. You know tepid sponging now. using clothes to, you said woman, clothes to wet the child's body. Uh-huh. Or you can say a cold bath. The woman said she actually takes, actually bathes the child, and then symptoms relieve, the fever relief. Say a cold bath, taking a cold bath. You get? So these are some of the things. And it persists 30%. I said, but just watch the next video on how to analyze different symptoms. That's the first thing you do in the history of presenting complaint. You analyze your symptom, analyze the complaint. After you talk about that complaint, you analyze it. You look for the possible cause. Now, if you have two symptoms, for example, we said we have vomiting and fever, for example, don't look for the cause of vomiting and now looking for the cause of fever. Look for what can cause the two together. That's the next thing you should think about. What are the things that can cause vomiting and fever? One of the common things that can cause vomiting and fever is gastroenteritis. That's where the normal knowledge comes in. Gastroenteritis can cause it. Meningitis can cause it. Otitis media can cause it. Do you get? So once you know the possible things that can cause it, you now try to find out what is the cause. So in history of presenting complaint, you don't only check for the analyze the complaint, you also look for the possible cause. So how will I know that this child perhaps have gastroenteritis? Gastroenteritis you can actually rule that out by asking, what did the child eat before this vomiting starts? How long did the child eat? Other people in the family, is there any other person that have this type of symptom? If the child actually ate something that is going to initiate that gastroenteritis, other people in the family will have it. You get now? So you may be saying there is no history. If it is gastroenteritis, you say there is a history of eating maybe so food, and similar symptoms are found in other siblings. Do you get now? That means you are talking about gastroenteritis. But you now rule out other things, that these things can also cause it too, but I don't think they are the cause. For example, there is no history of overcrowding as child sleeps alone or sleep with just one of his parents. Overcrowding is one of the things that can, one of the cause of meningitis. We are ruling out meningitis. It's not the cause of this vomiting and fever. You get now? There's no history of traveling to meningeal belts or traveling to the northern part of the country, meaning he has not traveled to the north where they normally have meningitis. Child is well immunized for age. The child that's not well immunized may come up with having meningitis. You get now, you are ruling out meningitis. You rule them out together. Otitis media, inflammation of the middle aspect of the ear, can actually result in this too: vomiting, fever. So you rule it out. There is no history of ear pain or discharge from the ear. The person listening to you knows you are ruling out otitis media. Those are the things you rule out. You get now? Other things can cause fever, and other things can cause fever and vomiting. Malaria is another example because we live in a hollow endemic zone. So you can simply say there is no history, or she sleeps under an insecticide treated net. Do you get now? And there is no bushes around the house. That simply means you are ruling out malaria. Don't simply say there is no history of malaria. When you mention something like that, you said rubbish and they will laugh at you. So you don't simply there is no history of malaria. Which one is there no history of malaria? No. Rule out the symptoms. Rule out the risk factors. Things that are supposed to give somebody malaria, not saying malaria itself. Do you get now? That's how you do it too. You rule out the risk factors, not mentioning there's no history of malaria. What are the things that can cause malaria? Not sleeping under insecticide treated nets. You get? Having stagnant water around, having bushes around. So you mention those things. There is, she sleeps under insecticide treated net. There is no history, or there's no stagnant water around the house, and there's no bushes around where they live. Simple, you rule out malaria. The person listening knows. You get now? That's how you rule out things. So you rule out things that can cause it. Then you rule in what you think is the cause. You get now? So if I think gastroenteritis is the cause, I simply say there's history of eating, there's history of similar symptoms in siblings. You get now? Or there's history of eating, of presenting with these symptoms after eating so. And it's also found in other family members. That's actually simply means the child is reacting to what he eats. All right. That being said, after that, they are supposed to talk about complication in history of presenting complaint too. Like what has this lead to? But here in pediatrics, in this region here, we don't deal with complications. If you have any complication, you take it to presenting complaint. You get, for example, a woman says, because of this, because my child is now vomiting, my child now has reduced activity, no longer running the way she's. You are supposed to put reduced activity in presenting complaint. So you now say child has fever, vomiting, and reduced activity. You get, you don't go and say complication. There's no complications here. We're talking about pediatrics here. All right, then after that, the next thing you go to is care so far. What has woman done so far? Still under history of presenting complaint. That's the last part of history of presenting complaint. So to make history of presenting complaint easy, let's just say 4C. Supposed to be 5, but let's say 4C. 1, the complaint. Then after you talk about the complaint, you talk about the cause. That's analyzing the complaint. COURSE. You now mention the cause. CAUSE. Ruling out possible cause. No need for complications here. Then the next is care so far. What have you done so far? Since onset of symptoms, you presented to a private facility where IV fluid was given, drugs which could not be ascertained. If you know the drugs, you write it there, they are giving. But with persistent symptoms, she presented to this facility for expert management. On presentation, urine or blood was taken for investigations. Mention all the things they've done. If they've even gone to a herbalist, you mention it. You get now everything that they've done so far, you mention it. Then after that, you are through with history of presenting complaint. Now you can now go to past medical history. What has been wrong with this child? Has this child come up with any symptom like this before? Is the child on any is the child chronically ill? Has the child been on admission before? Is there any chronic illness? You get now? See a sickle cell patient. Is there any chronic illness? Has he been on admission before? Have you given this child blood before? Is the child on any special drugs like child must just take? They are allergic to any drugs. This is past medical history and touch of drug history. Do you get? So after that, you go to obstetric history. Where did you actually give birth to this child? First of all, when you were pregnant with the child, did you even go to antenatal? So just in obstetrics, you have to do it antenatal before she even gave birth. Then you talk about the obstetric itself when she was giving birth. Then talk about postnatal. You get now. So you simply ask, when you were pregnant for this child, when did you actually go to the hospital? When did you go? What hospital did you go to? Were you compliant with your routine antenatal medication? Were you compliant with the visit? How many times did you even go? You get now. When did you present in labor? You had prolonged labor. Like, what is the mode of delivery? Was it vaginal delivery or was it cesarean section? You mention them. Then after that, the baby cry after birth. You get. If the baby did not cry, why? If it's cesarean section, why? You get. Then did you breastfeed your baby after birth? If you did not breastfeed, why? How long did you breastfeed your baby? You get something like that. These are the things you ask in all those obstetric history. Then you go to immunization history. Your child well immunized for age according to the national program of immunization. Don't worry, in my video I'm going to do a video on that national program of immunization. When specifically you are supposed to do specific at birth. Did you give your child hepatitis B vaccine, oral polio vaccine? You get, you give your child BCG. These are the ones you give at birth. You talk about that. After you talk about immunization history, you go to developmental milestone or developmental history. When did this child start to smile? When did the child start to sit with some? You hold the child to sit down. When the child start to sit without anybody holding. When the child start to stand. When the child start to walk. When the child start to run. Those are important things. When the child start to crawl. You ask those type of those are developmental milestones. For a child who is 8 years, 9 years, more than even have forgotten 12 years, they have forgotten those development. You ask how is this child doing in school? You get now, those are not the things you ask to know the developmental milestone. How's he doing in school? Is he performing like his mates? Well developed like them? Developmental milestone. You get now, those are the things you should ask. So after knowing that about the developmental milestone, the next thing now goes family history. Family history, you ask the father, what work is he doing? How old is the father? The mother, what work is she doing? How old is she? What type of house do they stay? Windows. How many windows do you have in the house? All these things I'm saying are things you must mention. You get now? How many windows do they have? Are they facing each other? So these are for things involving overcrowding. You must ask them. But if the child is a little bit old, if he take any drug, if he abuse drug or abuse alcohol, then you give your summary of your history. In your summary, you mention the important things about it. I have presented a 4-year-old primary 2 pupil. After mentioning those important things, but in few important things in the biodata, you go to the presented complaint who presented with fever of this duration, vomiting of this duration. Then you now mention your positives in the positives. You get? If, for example, the child has malaria, you mention those positive risk factors. Yes, history of not sleeping under an insecticide treated net, history of stagnant water around his house, and history of bushes around the house. These are positive symptoms. If there's any important negative you mention, but if there's no important, you leave. But you must mention that important positive that you find out. It's telling the person what your possible diagnosis is. Then you round off your presentation. That's how to give good presentation. Follow up the channel. I will be giving all the important clicking you need to know. They will be well presented here. So please like and follow. Thank you.